going to finish up the digestive chapter here, but we're going to talk about some of the accessory digestive organs and tissues and whatnot. And the liver is one of those, okay? It plays a pretty big role for fat digestion, but we're going to kind of discuss a couple of its characteristics. One, it's the largest internal organ. What's the largest organ of the body? Skin, yay. Where is it found? On the left side or the right side? Not the skin, the liver. Is it on the left or the right? The liver. It's on the right. Yeah, it's right there, actually, right above, or not above, but you should feel it right below the rib here. Okay, and normally, well, you shouldn't feel it actually, unless it's in the large liver. But one of the ways that you can palpate for, if you're starting to think there's some sort of pathology for the liver, is have the patient lay on their back, knees bent, have them take a deep breath in, and then blow out. And as they're blowing out, just kind of curl your fingertips up under the 12th rib there in the front. You shouldn't feel it. If you do, there's a good chance that they have a large liver for whatever reason, hepatitis, several pathologies that can affect the liver there. All right. But when we're talking about digestion, its main function is to produce bile. Bile is going to help with the breakdowns of fats, okay, emulsification of fat, okay? So this liver here, again, is going to be a tissue, an organ that is surrounded by a capsule, okay? We'll talk about it with the kidneys. We talked about it when we were talking about the adrenal glands. Adrenal gland has a capsule. And so these capsules, these organs that have a capsule surrounding it, that capsule will penetrate and invaginate into the internal portions of whatever we're talking about. And in this case, all right, same thing will happen with the liver. That connective tissue capsule will invaginate in and it will section off parts of the liver, which we'll get into. So it's covered by a capsule, and it's also going to be covered by, all right, the visceral peritoneum here, except for one small area where the liver makes direct contact, all right, with the diaphragm, okay? So I feel like I talked about this last time. Didn't I talk about this? Two main lobes to the liver. There's actually 4 lobes, but 2 main lobes. All right, you have the right lobe and the left lobe. The right is the larger of the two, and then there's 2 smaller lobes that are part of the right lobe. All right, the quadrate and the caudate lobes. And we'll discuss those in a second. The left and right lobes are separated by the falciform ligament. That's the ligament that will attach, all right, the liver to the anterior portion of the abdominal wall, all right? And at the free edge of the falciform ligament is the round ligament of the liver, which at one point used to be a blood vessel. But once baby was born, all right, that blood vessel collapsed, all right, and it is now known as the round ligament. It used to be the fetal umbilical vein, okay? And that's going to be found along the free edge of the falciform ligament, okay? The quadrate lobe, this is, I'm almost positive I talked about this one because this is the one I told you where the caudate, C vena cava, all right? So the caudate is going to be adjacent to the inferior vena cava, all right? And then the quadrate lobe is going to be adjacent to the gallbladder. All right, so on the inferior posterior view, we'll be able to see the inferior vena cava. We'll also be able to see another embryonic tissue here, the ligamentum venosum here, all right, and that is another fetal blood vessel, okay, called the ductus venosus there. All right, and then where all the blood vessels that are going to go into the liver, all right, and also exit the liver, all right, that is the porta hepatis. That's what we'll see: blood vessels, lymphatic vessels, the bile ducts, all right, the bile duct that's going to exit and go to the gallbladder. Nerves are all going to be entering in and out of that region there. So on an anterior view here, you can see here's the right lobe, left lobe, right is larger, all right. Posterior behind that is going to be the inferior vena cava, and then the structure that divides the left and right lobe from one another is the falciform ligament. On the inferior portion, the free edge here, that's the round ligament of the liver. And so the falciform ligament is going to actually connect to the internal surface of the anterior abdominal wall there in the front. So if we look at the bottom of the liver, all right, you can see, all right, again, you have your right lobe here and the left lobe. All right, then you can see where the gallbladder is more towards the anterior portion of the liver. All right, between, all right, the falciform ligament there, all right, and the gallbladder, there's the quadrate lobe there. All right, as we move back towards the posterior portion here, because here's the inferior vena cava, there's the caudate lobe, all right, and then just adjacent to that is the ligamentum venosum here. And then where all these blood vessels are entering and exiting, and where you're getting the bile duct that's exiting, going towards the gallbladder, that's the porta hepatis there. So here, let's look at the one here, and come on now. Okay. Here's the one in your atlas there, okay? So here's the right lobe, here's the left lobe, all right? And then you can see you have the falciform ligament dividing the left and right lobe, okay? In between the falciform, all right, and the inferior vena cava, okay, that's going to be the caudate lobe. Up here anteriorly, all right, is the quadrate lobe adjacent to the gallbladder. This is the gallbladder right here. And then you've got this ligament over here, all right, we call that the coronary ligament. Coronary means crown, but it always confused me because normally the coronary ligament's on top of something. This one here is on the posterior and inferior portion of the liver. So I don't know where they got that from. Okay, so a couple things to discuss about the histology of the liver. Remember I was telling you about the CT capsule, all right? It invaginates into the tissue, and it's going to divide the liver up into hepatic lobules. We saw that, something similar to that with like lymph nodes, where they were divided up into lymphatic nodules there, all right? So these hepatic lobules are the functional units of the liver, all right? And the cells of the liver, the hepatocytes, are going to be the cells that produce the bile there too, okay? And so we're going to talk about their role here. But we got to talk about a few structures here. First, you have a portal triad. All right, a triad is going to be a structure of 3, and that's going to include, all right, a vein and an artery. So we're going to have the hepatic portal vein, all right, and the hepatic artery, all right, and then we're going to have the third structure be what we call a bile ductule. Okay, because the liver is going to be making the bile, and it's going to be excreting it into the gallbladder, so the gallbladder can then concentrate it and store it for when the time is right, when you eat a fat-rich meal there, okay? At the center, all right, of this structure, of these lobules, is the central vein. So you know what? I'm just going to show you these pictures here real fast, okay? So here we're looking at a hepatic lobule. This is one whole lobule right here, okay? So on the periphery here, all right, you can see we have our portal triad here, okay? And it's made up of 3 structures, all right? A vein, an artery, and a bile duct here. And then at the center, all right, is going to be what we call the central vein, all right? And so things will drain into that vein, okay? So that's freaky. Yeah, I know, trippy. Oh, bummer. Yeah, I know. See, someone started St. Patrick's Day early. All right. So, butterbeer. Has anyone ever had butterbeer? It's not real beer. It's like cream soda, and have you had butterbeer? Yeah. Well, it's very sweet, but it's tasty. All right. So on the periphery of these lobules, that's where you're going to have the portal triad. At the center, you will have the central vein here that is going to drain blood, all right, from these blood vessels here into the center, all right? But it has to pass through these structures here, are hepatic sinusoids, all right, in which we're going to see a mixing of this blood, okay? Some of this blood is already mixed, all right? Remember, portal veins are a mixture of blood already, okay? And I think I'm bummed about that. I'll try to go through those slides for you, okay? So blood will flow from the triads to the central vein. There will be a mixing, all right? And we will see that, all right, in the hepatic sinusoids there, all right? But the hepatic vein will then form the central vein will then form the hepatic veins, and the hepatic veins drain into the inferior vena cava. All right? You don't know what any of this is saying to you, all right? So I will kind of go off of this, all right? Remember, all right, the hepatic artery, okay? The hepatic artery is going to be the artery that comes off of the celiac trunk. And that's that hepatic artery that's going to supply the tissue of the liver. All right, so it's going to bring oxygenated blood to the liver, all right, for metabolic purposes there. The hepatic portal vein is formed from the splenic vein and the superior mesenteric vein, where they both come together. That forms the hepatic portal vein. Now, mind you, the superior mesenteric vein, okay, when it meets up with the splenic vein, but the inferior mesenteric vein drains into the splenic vein. The reason why I tell you that is superior mesenteric vein, inferior mesenteric vein drain your intestines. Guess what came from the intestines? All the stuff that you just absorbed, all right, that you were digesting. So lots of fats, proteins, nutrients, nutrient-rich stuff, all right? So these veins, all right, are going to be loaded down with tons of nutrients, okay? So they're going to come, all right, up into the liver, and they're going to dump about 75% of whatever they have into the liver. As that happens, all right, that hepatic portal blood mixes with the blood that came from the hepatic artery. Okay, so you got oxygenated blood mixing with partially oxygenated or deoxygenated blood, but nutrient-rich, and all that's getting mixed around in the liver, okay? And then that blood will drain into the central vein, into the hepatic artery veins, and then into the inferior vena cava, okay? So think of, whoa, funky. All right. I'm just trying to see. Okay, so nutrients. Oh, keep in mind too, in these hepatic lobules, we have macrophages. All right, I would spell it out for you. Actually, I can kind of spell. I think this will write correctly. Kupffer cells. All right. Kupffer cells are just macrophages that they're going to clear any type of infectious agent or pathogen there. All right. Bile. Okay, you can't really read what it says here, but bile for the digestive portion of the liver, okay, it's its main function. Bile is going to contain bicarbonate. You guys remember what bicarbonate is, right? It's a buffer, right? It helps to maintain or decrease the acidity of something, right? It's not gonna be a neutralizing agent, but it's a buffer. Just think about it. All right, bile gets produced by the liver, gets stored in the gallbladder. The gallbladder will actually excrete its contents into the small intestine, specifically the duodenum. All right. Well, the duodenum is close to the stomach, so that chyme that comes out of the stomach is very acidic. It has a low pH. So we need to try to buffer and neutralize, all right, that acidic chyme. Well, the bicarbonate from the bile helps with that. Okay. We also have bile salts, lecithin, and mucin. Those will help. Well, the mucin will help to create lubrication, while at the same time also decrease or actually increasing the pH. All right, but the bile salts will help to digest, all right, the fat that's found in the chyme there. Okay. All right, that's not a great slide there, so I apologize. I don't know why that did that. Okay, so here you can see. So the portal triad over here at the corner, all right, you're going to have your mixed blood coming here, all right, from the hepatic artery and the hepatic portal vein. We're going to see mixing in the sinusoids here. I'll zoom in a little bit easier here. All right. So you've got this small vein here that's going to be carrying hepatic portal vein blood, which is going to be nutrient rich, still going to be somewhat deoxygenated. Then you've got your hepatic artery. So there's going to be a mixing of the blood here in the lobule, and they'll all drain here into our central vein. That central vein will drain into the hepatic veins, which will drain into the inferior vena cava. Meanwhile, Blood goes this direction, all right? Bile goes this way, goes from the inside out. Okay, so blood is going towards the central vein, and bile is going away from the central vein because it's draining into the bile ductule. And the bile ductule will drain into our bile ducts, which will then eventually, it'll drain from both lobes and go and drain into the gallbladder. Okay? So just a reminder of the hepatic portal system. Okay? Here are the three veins that are going to make up the hepatic portal vein. Okay? You've got your inferior, all right, mesenteric vein that combines with the splenic vein here, and then where the splenic vein and the superior mesenteric vein meet up, that's where it forms the portal hepatic vein. The portal hepatic vein, along with the hepatic artery, all right, then they'll branch off and make smaller and smaller veins, will go to these hepatic lobules, which will get the mixing of blood, will saturate all the cells here in these hepatic lobules, and then all that blood drains into the central veins, which will eventually drain into the left and right hepatic veins back into our inferior vena cava. Okay? So, hepatocytes, they make bile. That's cool. All right? We know what bile is doing as part of the digestive process. All right? Contains cholesterol, which cholesterol is wonderful because it's going to be used for lots of hormones. It's also a component of plasma membranes. So it's an important component to have floating around in our bodies. The lecithin, all right, and the bile salts will help to break down the fats. The mucin will help to make mucus, so we can actually lubricate more of our digestive system. You can never have enough lubrication in the digestive system. Trust me on that, all right? And plus, the mucus, all right, can help regulate pH levels slightly, all right? And then we have the bicarbonate. So the gallbladder, okay, this is a commonly misunderstood thing. The gallbladder does not make bile. It does not make that. Don't be fooled, okay? People that have had their gallbladder removed, that had a cholecystectomy, no, because they can still eat fatty foods. They just can't handle the fatty foods as well as they used to, because the gallbladder is going to store and concentrate, all right, the bile, okay? So it makes the bile more effective. All right, so when the bile is going to be stimulated for release through a hormone called CCK, cholecystokinin, talk more about that in lecture, all right, it's going to excrete the bile into, all right, the small intestine, in the duodenum, and we'll talk about that here, all right? So we still have our three layers here, all right, when we're talking about the gallbladder. All right, and there's folds on the inside that will stretch out as the gallbladder fills up. All right, so we'll see that the common bile duct, which is going to connect to the cystic duct, well, I can tell you this or I can just show it to you. There we go. All right, here's our gallbladder. Okay, so you have both your right and left hepatic ducts, all right, which come from the right and left hepatic lobes. So the bile is made in those lobes, all right, where they both combined here, all right, that's going to be our common hepatic duct. Then the common hepatic duct will drain the bile here, all right, into the cystic duct. When it's time to secrete the gallbladder bile, okay, the gallbladder will contract, all right, the sphincter here at the end will relax, and it'll excrete the bile out through, all right, the common bile duct into the duodenum of the small intestine. All right, pancreas, another accessory organ. We've already talked about the fact that the pancreas is an endocrine exocrine gland. Okay, it has both functions. Okay, endocrine, ductless. All right, exocrine, a gland that has ducts. So we talked about how it produces insulin and glucagon for its endocrine function. So we don't have to worry about that now. Exocrine, all right, we are going to discuss how it creates the pancreatic juices here. All right, more so in lecture. I'm just going to go over a couple parts here. All right, pancreas is located in the middle, central portion of your abdomen. Okay, right in the middle there. Okay, to me it looks like a cane on its side. All right. So it's tucked nicely into the duodenum, because the duodenum comes off, all right, of the stomach, and it has 4 parts. All right, it comes down, over, and up. Okay. Anyways, this thickened portion where I'm putting the X here, that is the head, okay, of the pancreas. It thins down over here, all right, that's the neck. Then this long portion from here to here, okay, that's going to be the body. And then where it becomes small and tapered, that's the tail, okay? And the tail sits right up against the spleen here, okay? So the pancreas is right in the middle. It is a retroperitoneal organ, okay? So it's going to be behind the peritoneum there. So here's a way better picture. I don't even know why I bothered drawing for you. I thought mine was pretty good though. Okay, so if you look close here, you can see inside of our pancreas here, we have some ducts. There's 2 ducts that you need to know. The main duct is called the main pancreatic duct. That meets up with the common bile duct. And both of those ducts then converge, all right, and will produce or empty their secretions here, all right, in the major duodenal papillae. That's that opening there, right here into the second portion of the duodenum here. Now the pancreas has a smaller duct, all right, that's more superior to the main pancreatic duct, and that's the accessory pancreatic duct, much smaller. And so it has its own little opening here in the duodenum, and that's the minor duodenal papillae there, okay? And both of these papillae have sphincters there, all right? So those muscles will control, all right, when the digestive juices and bile, all right, will be expelled into the duodenum. All right, so here you can see in way better detail, here is, all right, your gallbladder, and you can see your common bile duct coming right through here, and it's going to merge up here, all right, with the main pancreatic duct. So here's the main pancreatic duct, okay, kind of does some funky stuff here, then it comes down this way here, meets up with the common bile duct, all right, and then it's going to empty its contents here into the major duodenal papillae opening into the duodenum. All right. The accessory pancreatic duct is superior to the main pancreatic duct, right up here. Okay. Doesn't meet up with anything, and then it's going to excrete its contents here into the minor duodenal papillae of the into the second part of the duodenum here. Okay. All right, we talked about how the small intestine has these circular ridges. All right, these circular ridges act as speed bumps, and they help to mix the food. All right, increase the surface area here. We call those plicae circularis, right in through here. Okay, here's the head of the pancreas. Here's the body of the pancreas, and very end here, the tip down by the spleen here. All right, that will be the tail of the pancreas, and where it kind of narrows down is the neck of the pancreas there. Okay, so looking at some of the cells from the pancreas, all right, on a microscope, we talked about how we have the acinar cells. We didn't really talk about their function when we were talking about the endocrine system, because we were focusing on the beta and alpha cells, because those are endocrine cells, all right? The acinar cells here, all right, are going to have a different shape. They're not going to be columnar shape. Up to this point, we've pretty much been talking about columnar cells, all right, simple columnar cells. We've been talking about stratified squamous and whatnot, but these are going to be simple cuboidal cells, okay? And so they're going to create these clusters or these sacs, all right, which we call acini here. And it's going to be in these clusters or sacs where they're going to release their digestive components, all right? And it's going to release the digestive components into ducts and then eventually into the accessory pancreatic duct or the main pancreatic duct, okay? So it's these cells here, all right, the acini cell, the sac-like portion, all right, of this structure. This is the acini. It's like a grape on a grapevine here, all right? That is going to make the digestive enzymes, okay, which is pancreatic lipase, pancreatic amylase, okay, helps to break down all right, fats, all right, carbohydrates and whatnot. Okay, so that's made in this portion, the secretory portion. But as it starts to taper down here into the thinner portion, the duct, that's where we're going to deal with the cuboidal duct cells that make more bicarbonate, which again is going to have a more basic property to it, which means it's going to have a higher pH. And so this will also attribute to the buffering actions, all right, of the secretions that go into the duodenum. Okay, we see from bile. The bile is producing bicarbonate, and that causes a buffering, all right? And we also get it here, all right, from the pancreas, all right? The ductal cells, right, that are close to the acini will also produce an alkaline or basic bicarbonate fluid, and that will also help to buffer, excuse me, it will help to buffer the acidic chyme that's coming out of the stomach. Okay, so here's your acinar cell. Okay, it's going to be producing all these pancreatic digestive enzymes. All right, and then these smaller cells here, the duct, that's going to be producing the bicarbonate there. Good so far? Cool, cool, cool? All right. All right. So let's get back into the GI tract. Okay. And let's talk about the large intestine. Give me 1 second here. Okay, large intestine. I know, we didn't really talk too much about the small. We did talk about the small intestine. All right, sorry, I'm losing my mind here. Whew, I was like, wait a minute. All right, so the large intestine, we saw this back in Bio 210. Okay, we talked about the different parts of the large intestine, the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and all that, okay? So the first portion is known as the cecum. That's this little outpouching in which the ileum of the small intestine is going to empty its contents, all right, the chyme, into the cecum. All right, and there's a little valve there. Of course, there's always a valve in between these things. All right, it's known as the ileocecal valve. All right, and that's going to release the chyme from the ileum into the cecum. Okay, again, this is going to be located in the right lower abdominal quadrant. Okay, which, if you know, if you have, all right, appendicitis is a common site for pain because the appendix or the vermiform appendix hangs right off of the cecum. It's inferior to the cecum. All right, this is an intraperitoneal structure, okay, and it hangs inferiorly off of the cecum, okay, and in some cases, an infection can occur. I mean, most of the time, folks, all right, is believed to have beneficial bacteria, but like I told you, in some cases, think of bacteria, even though some folks will say, oh, it's normal flora and we need this for digestion, it's an opportunistic organism. It's just waiting for the time to do what it wants. Well, not what it wants to do, but what it can do. Okay? All right. We'll also see lots, all right, of immunologic tissue there also. Why did this happen? I swear to you, this was not. Did I skip one? I think I did. Cecum. Okay, anyways, so consider, I'll run through this real fast. All right. The large intestine, another name for that is the colon. The first part past the cecum is the ascending colon. All right, that's going to be found on the right side. All right, it's going to head up towards the liver. All right, and then it takes a 90-degree turn. Now remember, the right colon or the ascending colon is retroperitoneal. It is going to be behind the peritoneum, okay? And so it takes that sharp 90-degree turn at the liver. We call that the right colic flexure, or we also can call that the hepatic flexure, okay? Then it runs across. Here, let's get back into something we can read. Come on now. All right, then it traverses from the right side of your body to the left side of your body. All right, we call that the transverse colon. The transverse colon is intraperitoneal. It is within the peritoneum there. All right, and it all travels to the left side, and where it takes another 90-degree turn, that is known as the left colic flexure or the splenic flexure because it's near the spleen. Then we move into the descending colon, another retroperitoneal structure. okay? And it heads down towards the sigmoid colon. It gets to the sigmoid colon, it is no longer retroperitoneal, it becomes an intraperitoneal structure, but it is going to now make a beeline to the center of your pelvic floor. So it is going to move inferior and medial to the pelvic cavity. And it comes to a screeching halt at the rectum. The rectum is our storage place for feces. Okay, at this point, you're at the final part, all right, of digestion. Okay, not the final part. We're getting close to the final part, which is elimination. Okay, we've absorbed as much as we can, and when I talk about absorption, I'm talking about as many nutrients as we possibly can get out of it. We've gotten rid of a lot of water. Okay, we all know what happens when your large intestine and small intestine don't do their fair share of absorbing water. All right, we have a song for it. It's called diarrhea. Okay, and so, all right, we've seen that. Some of us have experienced that. So in the last portion, not the last portion, but in the rectum here, think of it as just a place where we're going to store the feces here. And in that rectum, we have these thick folds here. We call those rectal valves. Okay, and so that will kind of help to partition off certain parts inside the rectum for the feces there. All right, as feces starts to build up in that area, it'll start to put more stretch, okay, on the wall of the rectum, stimulating baroreceptors, giving us that urge to go to the bathroom for defecation, okay? This is another retroperitoneal structure. So you can see here, I'll make sure I didn't skip them, okay. All right, so here's the ileum. It empties in here into the cecum. There's the ileocecal valve. Inferior to the cecum, there's our vermiform appendix, okay? Both of these are intraperitoneal. Now we go into the ascending colon. Okay, that's a retroperitoneal structure, takes a 90-degree turn here by the liver at the hepatic flexure or the right colic flexure, and it crosses across the body. All right, the transverse colon here, that's intraperitoneal. Then it takes a 90-degree turn here by the spleen, the splenic flexure or left colic flexure, it goes inferior, all right, through the descending colon, that is another retroperitoneal structure. And then it takes a beeline here at the sigmoid colon. It turns back in. We're now intraperitoneal again, and it makes a beeline to the center of your pelvic cavity before it becomes the rectum here. Okay, rectum is also retroperitoneal. All right, before the final portion where we get to the anus here. Okay, the anal canal, now that is the part of your digestive tract that is going to take on the last part of digestion, elimination. Okay, we're going to get rid of all of that stuff. It is lined by stratified squamous epithelium. Thank God. Right? Thank God. Okay, stratified squamous epithelium, mechanical stresses. Feces aren't designed, all right, to be, I won't say easy on the body, all right, but all right, that's a lot of wear and tear there. Okay, so we're going to be sloughing off cell layers, so it's better to have it be stratified than simple. Okay. So this portion, the anal canal, is going to go through the levator ani muscles. If you're not sure what that is, that's the pelvic floor. Okay? Those muscles are the muscles that are holding your guts in, essentially. If those muscles weren't working, everything, well, I wouldn't say everything would fall out, all right? But you'd have organs kind of protruding out. And when you have a weakness, okay, in these muscles, you can get, have you ever heard of a prolapsed rectum? All right, prolapsed uterus. Okay, that's not strictly for levator ani, all right, but they contribute to that. Okay, so we don't want to have weak levator ani muscles. All right. Okay, so in the anal canal, all right, we start to see these ridges here. I'll just show you. Okay. All right, these ridges here, those are going to be the anal columns, and then in the depressions here are the anal sinuses, and in those sinuses, all right, we get a lot of mucus production. Okay, like I said, you can never have too much mucus, okay, especially in the digestive tract. Again, that allows for the ease of the passage of the feces, all right, out of the rectum, okay, when you have to defecate, okay. So we'll see there in the anal sinuses, all right, lots of mucus being released. And then finally, we have two muscle sphincters at the distal or terminal end of the GI tract. Okay, the internal anal sphincter, which is under involuntary control, that's smooth muscles. All right. And then we have the external anal sphincter. That is voluntary. This is the one that pretty much allows us to have some, I won't say some, a lot of control over our bathroom habits. Okay, this is the muscle that your parents took the time to teach you how to use on your own. So you didn't have to use the diaper in your pants anymore as a toilet. Okay, it's the external anal sphincter that is going to allow us, for the most part, to control when and where we go to the bathroom. For the most part, not every time. Okay, so here you can see, all right, here's the levator ani muscles. Okay, that pelvic floor. And then on the internal portion here, those are the internal anal sphincters. This is smooth muscle. And then the external anal sphincter muscles, that's the skeletal muscle. Okay? So in order to have a bowel movement, you have to relax both the internal and the external anal sphincter muscles to allow the passage of food to exit. Okay, couple things when we're looking at the large intestine that you may have noticed on this picture here. Okay, you can see you've got this strip here that runs along, that's called the tinea coli, and it's the tinea coli, which is smooth muscle, and it helps to create these guys, these sacs, which we call haustra. Then you can see we also have the omental appendices here, which are just globs of fat that like to hang off, all right, of the large intestine there, okay? We'll just see this. But think of the tinea coli like if you're wearing sweatpants or athletic shorts, all right? It acts like a waistband there, okay? And so when it bunches up on the large intestine here, it makes these sacs, the haustra there. All right, so on the inside of the large intestine, again, simple columnar epithelium. So when we see that simple columnar epithelium, we're still getting absorption of materials here, okay? Our digestive system hasn't given up yet. I mean, it's still going to digest or absorb, all right? It's still going to try to get as many nutrients as possible, all right? It's going to try to get as much water as possible, electrolytes as possible, fat-soluble vitamins, everything that it possibly can. It's going to go for here, all right? So we're going to see tons of goblet cells, okay, which is important, right? What do goblet cells do? They make something, begins with a M, mucin. Makes that mucin so we can make that mucus, all right? Because we're going to start to see, all right, that digested material is going to start to take a less liquidy composition. It's going to become more solid. If it's more solid, it's going to be harder to manipulate its shape, so we need to have as much mucus there to ease its passage, okay? Now, we haven't really talked about this. Well, we talked about it on Monday, all right? In this area, a big difference between the large and small intestine is in the large intestine, we don't have the intestinal villi, okay? The intestinal villi help to increase surface area and digestion, okay? We don't have those in the large intestine. Okay, but we surely do have a lot of this going on, a lot of mucin, and we have tons of lymphatic nodules. Okay, so we're keeping up with our immune system there. Okay, so we have our two layers of smooth muscle still. Okay, the longitudinal layer, all right, we'll see that has that tinea coli on the outside. Okay, that helps to make that haustra there. All right, so when we're looking here at the large intestine, all right, we don't have the intestinal villi, but we still have in that mucosal layer, all right, we have these big invaginations here lined with all these different types of glands. Look at all, well, you can see it way better on this one. Look at all these kind of clear cells. Those are goblet cells. It looks like there's way more goblet cells than epithelial cells, all right? That's just to kind of give you an idea how many more, all right, goblet cells you'll see in the large intestine compared to the small intestine, and the ratio between epithelial cells, all right, and the goblet cells, okay? So very similar. We look at it, here's the mucosal layer, all right, and then below that we have our submucosal layer with the blood vessels, okay, and the lymphatic vessels, and then we'll see even further down here, all right, in the muscularis layer, we've got our circular layer still, and then we've got our longitudinal layer on the outside of that. That's that tinea coli that we saw on the external surface there of the large intestine. and then that's surrounded by the serosa. All right, let's do some labeling, and then let's get the heck out of here. Okay, so here you can see, all right, when we're looking at our large intestine here, this should be, as you're writing some things down here, mucosa. All right, so you want to be able to identify all the layers, okay? So the top superior most bracket is referring to the mucosa, all right? Then going down here a little bit lower, that layer below it is the submucosa. Again, think of the submucosa as where all the blood vessels are going to be found, all right? Remember, we got to get that absorption in there, okay? Then we go further down here, all right, layer 22, all right, that's going to be the muscular layer there, the muscularis, and then finally the outermost area here is the serosa. Okay, so you can see again, right, in the large intestine, we don't have those huge villi that we saw, all right, in the small intestine, but we can see, all right, where the blood vessels that were found, all right, in the submucosal layer, the lymphatic vessels, the arteries and veins, all right, they're giving off capillaries and smaller lymphatic capillaries that are going up into these villa-like structures here. Okay, then we can see here is one of our lymph nodes, this blue structure right here. All right, what am I missing? Oh, yellow structures are usually going to represent nerves. So you can see where there's a little congregation of nerve fibers here. That's going to be our submucosal plexus here. All right, that's going to be obviously submucosal plexus and the submucosa. All right, and then when we go further out here, this is where we're going to have the myenteric nerve plexus, also known as the Auerbach plexus. Okay, circular layer is always going to be deeper, all right, to the longitudinal layer. Okay, circular layer will be closer to the submucosa. Longitudinal layer will be further out, closer to the serosa. Questions about that so far? I'm going to take a quick sip here. Okay, last slide. Woo-wee. All right, zooming in, and we're focusing, all right, mainly on, this is going to be, this should say mucosa. 24 there should say mucosa. Okay, so in the mucosa, you can see a little bit closer here. Here's where all that epithelial tissue is, right up in here, okay? And then in these little villi here, these kind of appendages that are coming out, all right, on the inside, you'll either have your capillaries, the villi capillaries, unless it's green, and that's going to be representing our lymphatic vessels, and you'll have a lacteal that goes up here into this vessel over, or to this villi over here, all right? And then at the bottom of these villi, way here, that's where you're going to see the intestinal gland, all right? At the bottom, you'll have the crypt, and the gland will be down here at the bottom here, okay? Usually you'll have the crypt, which is the opening up into this structure, and at the bottom will be the glandular portion. All right, this layer here is that thin layer of smooth muscle, all right, that we talked about, and that is going to be that muscle tissue, all right, the muscularis muscle tissue that is going to contract and push the secretions up and out of these crypts here and try to push it out towards the lumen, okay? Intestinal epithelium, I think I hit it all. Yeah, questions? Okay, you have everything that you need, right, for your test tomorrow. All righty then. Folks, have a great weekend.